Sever's disease. What is it? How do we recognize it? And possibly more important, how do we treat it in our chiropractic offices? Sever's disease is a diagnosis of exclusion. There's three main variables we need to look at. The first is patient age. And the reason the patient age is so important is that calcaneal apophysis is not fully formed and not stable till about 15 years old. So if you have a patient between that 8 and 14 range, this diagnosis should be on your mind with any kind of a heel pain. The next is location. So when we look at location of heel pain, if it's on the posterior aspect, right where that Achilles tendon attaches to a calcaneus, that's where we're going to have our issues. That's where someone's going to be really tender in there and swollen. The last is an orthopedic test called the heel squeeze test, creating some medial and lateral compression to that calcaneus and looking for reproduction of pain at the same location. Now keep in mind, you can also do this test when they're standing, not the heel squeeze, but you can test to see if is it a bone problem or is it a problem somewhere else. And with that, you can have the patient stand on their forefoot, which does dorsiflex that first ray and increase the tension along the plantar fascia and also Achilles tendon and engage that windlass mechanism. If you can have someone walk on their forefoot and it takes away their heel pain, it's probably not Sever's disease. It's probably more of a muscle issue. It's probably more of an Achilles tendon issue. It's probably more of a plantar fascial issue. So those are ways that I can recognize Sever's disease. Now, what do I do about a patient with Sever's disease? Unfortunately, you're going to shut that patient down. If they keep on irritating it over and over again, it just gets worse. You can try doing heel cups. You can try doing anti-inflammatories. You can try icing it. But realistically, you just have to shut them down for about 2 months is what the literature says. Now, what about the patients who don't have Sever's disease, or you have a patient who did have Sever's disease? Now what they do, if they don't change the way they run or do the right kind of exercises, they can irritate something else. The knee-jerk reaction with patients when they have an Achilles tendon issue, a plantar fascial issue, or a muscle, intrinsic foot muscle issue, is to put them in orthotic. And I want to caution against that, not for all patients, but for most patients. Because what we know from patients who have plantar fascial issues or heel pain issues is they have weak toes. They have weak peroneals. And if we start to put an orthotic in it, it actually makes them even weaker. So while it may feel good to put that orthotic in, it's actually not the treatment of choice. Can we put it in short term? Yes. Can we use taping like the video you're going to see here, creating anchor on both sides and creating some anti-pronation taping and support for those tissues while it heals? Yes, but that's not a good long-term solution. So whether it's Sever's disease or whether it's a plantar fascial issue or Achilles tendon issue, we need to make sure that we attack the cause, which is weakness in those muscles. So one thing we can do is use a device like a toe probe, or you can use a step with a towel underneath the first ray. But I love this toe probe exercise as you see here. And the reason is because their forefoot is on the surface. It's going to throw them into dorsiflexion to essentially load that tissue of the posterior chain. It's going to keep that big toe dorsiflex. And as you can see from the video, rolling outward with their body, activating those peroneals, and then rolling back in towards that first ray, you're going to activate all the muscles that you're looking for. Because if you have somebody with flat feet, like you're seeing here, they are 20 times more likely to have a heel pain issue. If you have pes cavus and a really high arch, you're 80 times more likely to have a heel issue. So we need to support those patients if they are performing a sport or an activity like running, like jumping, that's really going to aggravate those heel pain structures. So I hope this helps. This is a device by Tom Bichaud. You can pick it up at Human Locomotion. You can also look at varus and valgus posting for feet versus an orthotic. There's a lot of great research in that. But the main purpose of this blog is to make that differentiation. Do I have a bone issue? Cycle that person down. Or do I have more of a tendon or a muscle issue? And now I need to strengthen that patient up. Making that differentiation makes all the difference for your practice and also your patients. I hope this helps.